I'm here to speak locally today about a motion I tabled this week at Queen's Park to expand pharmacare in Ontario so that all Ontarians have access to prescription medication. I'm very proudly joined today by Tom Cooper from the Poverty Roundtable, by Daryl Jerome, President of OSSTF 21, by Frank Crowder, President of United Steelworkers Local 7135, and by other representatives including Kim O'Hearn, Vice President of Local QP 7800, Tracy Langle, CUPW President 548, Chris Grayway of the Hamilton Injured Workers, and Anthony Marco, President of the Hamilton District Labour Council. We're all here today because we believe strongly that access to pharmacare should be universal in this province. We know that across Ontario today, there are people standing at their pharmacy counters trying to do a mental calculation about whether or not they're going to be able to pick up their prescription and pay their rent in the same month. And we can do so much better for the people of Ontario. Currently, 1 in 5 working Ontarians here do not have any access to prescription medication coverage whatsoever. And as a result, we see many people in our communities who are making impossible choices, who are not able to receive their treatment that they need, or are having to skip or ration doses of their medication because they just simply can't afford to take it every day. And so this week, I advanced a motion asking the government to expand access to the Ontario Drug Benefit to all Ontarians, regardless of age, income, or employment status. This would be one thing that we could immediately do to try to improve access to pharmacare for people in this province. Because we know that Canada is the only high-income country with a universal healthcare system that does not have a fully funded requisite pharmacare system. And when we talk about only paying for your healthcare with your OHIP card, never your credit card, somehow that promise seems to get lost in the time it takes to go from your doctor's office to the pharmacy to fill your prescription. And every year, Ontarians are spending millions of dollars out of their own pockets that isn't going to groceries or rent because they're trying to cover the cost of medication that we could be covering for them. By expanding access to the Ontario Drug Benefit, we could immediately put that money back in people's pockets at a time when we know the housing prices are going up astronomically, food prices have increased tremendously, and the cost of living is becoming less and less affordable. We also know that when people are healthy, they're better to engage in our workforce, in our economies, in our communities, and that this is one thing we could do to support workers and support our communities and small businesses